Hey Helen, how are you going today?
I'm good, thank you, John.
That's good, thanks for coming in.
Not a problem.
Look, today I'm going to take you through a gold exercise pre-screening tool. Now, the purpose of this is to ask you a series of questions to try and get enough medical information about yourself as possible. Now, it's not intrusive and it's not personal, but it's the reason for this is we need to try and identify any contraindications you may have that make it for exercises that you might want to do or exercises we may give you to do. Now, we've got to identify anything potentially harmful that you might have. This could be like a sore muscle or even a sore ankle or something, right through to cardiovascular disease. So the answers that you give me in this little exercise will help us determine the level and type of exercise you'll be able to attempt initially. The other very important aspect of this screening is to ascertain whether you may need medical clearance from your GP before commencing exercise, and that's very important. So we'd hate to take you through something that's going to be bad for your health. So there's two sets of questions. The first one I could have got you to self-do, but I'm here now, so I'll do it. So it won't take very long. It's not overly personal. We don't need long answers. So are you okay to proceed?
Yes.
Righto, we've got your name, your date of birth.
23rd of the 3rd, 1943.
Obviously a female. Now, the aim of this stage 1 is to identify those individuals with a known disease or signs or symptoms of disease who may be at a higher risk of an adverse event during physical activity exercises. Now, as I said, this could have been self-administered and self-evaluated, but I'll run through it with you. So it's a simple yes, no answer.
Yeah.
So has your doctor ever told you that you have a heart condition, or have you ever suffered a stroke?
No.
Do you ever experience unexplained pains in your chest, rest, or during physical activity or exercise?
No.
Do you ever feel faint or spells of dizziness during physical activity exercise that causes you to lose balance?
No.
Have you had an asthma attack requiring immediate medical attention at any time over the last 12 months?
No.
Do you have diabetes type 1 or type 2? Have you ever had trouble controlling your blood glucose in the last 3 months?
I don't have that diabetes.
That's great. Do you have any diagnosed muscle, bone or joint problems that you've been told could be made worse by participating in physical activity or exercise? Do you have any other medical conditions that may make it dangerous for you to participate in physical activity exercise?
No.
Well, you've answered no to all those questions. So if you have no other concerns about your health, we could have you undertaking light to moderate intensity physical activity or exercise in the gym. So we could tailor a program for you to do that. But I'll just get you to sign that if you don't mind.
Right. Yeah.
I'll take it later.
Okay.
Now, the second part of this exercise screening tool, we'll just get a bit more information about you that'll ascertain what level that you could go, if you could go to a level above that. So we've got your other details before. So your age now?
71.
71. You're pretty fit for 71, aren't you?
Yes, I am.
And you're obviously a female. So you've got a +1 risk factor there, only because that you're a female over 55. So we'll just go through some of your family history. So is anyone in your family, that's your father, brother, or kids, or mother, or sister, or daughters, got a history of heart disease, stroke, or heart attack, or anything like that?
No.
No. Do you smoke at all?
No.
Have you ever smoked?
No.
Oh, that's good. Describe your current physical activity. So, you're sedentary, or do you do some light exercise, or moderate exercise, or vigorous exercise at all?
I think I do a fair bit of exercise. I walk on the beach quite regularly every day. I play golf.
Oh, righto.
I go a bike ride occasionally and occasionally do kayak.
Oh,
I
righto.
like gardening and of course I do housework.
So you'd say you do moderate exercise,
Yeah.
and you do what, that's 4, 3, 4, 5 days a week?
Oh yes, easily.
5 days?
5 days, yeah.
And about how long would you do that for, do you think?
I suppose if you average that out, probably at least an hour a day.
So 60 minutes a day, that's pretty good, isn't it?
Yeah.
So that's 300 minutes a week. So that actually is really good because that gives you a -1 risk factor. So we take that off because that's quite a bit of physical activity that you're doing. Now earlier we got your height and your weight, and I worked out that your BMI was 26. So because it's less than 30 kilos per metre squared, that means that you're in a reasonable range of the BMI. So have you ever been told that you have high blood pressure?
No.
No, that's great. Have you ever been told that you have high cholesterol?
No.
And have you ever been told that you have high blood sugar?
No.
Right, so that brings you to a total risk factor of 0. So a total risk factor of 0. If you're less than 2, that means you're a low risk client. We'll come to that and explain that in a tick, but there's just a couple of more questions. So have you ever spent time in hospital, including day admissions, for any medical condition, injury during the last 12 months?
No.
Have you currently undertaken a prescribed medication for any medical condition?
No.
And obviously you're not, well, I shouldn't say this, but you're not pregnant, are you?
No, I don't think so.
Do you have any muscle, bone or joint pain or soreness that is made worse by any particular type of activity?
No.
Right, Helen. Well, as I said, you've got a risk factor of less than 2, which puts you in a low risk category.
Okay.
And low risk clients or individuals at low risk may participate in aerobic physical activity, exercise up to a vigorous or high intensity. So, and of course that comes back to the individual a little bit, but we'll tailor things for you from that, and we'll with our next question. So when we get into the next stage of it, we'll know where to go from there. So thanks for that.
Thank you.